All right. Well, thank you all for coming. Jeff Neisted, City of Kent Health Commissioner. It's always great to see you in Kent, always. I appreciate, I think this is wonderful to see the amount of faces here. And we really appreciate, I know, speaking on behalf of CHIP and Portage County, as well as Kent State University, Center of Public Health Policy, we really appreciate you guys coming here. You know, we're here for a community health assessment. I think this is the first real venture having all parties together in the same room, besides some of the work that Karen's done through her maternal and child health program. But you know, I know we've had a lot of assessments done. I know we all have to go through some assessments without a doubt, but we're really hoping this feeds the future of public health in Portage County. I know Chip and I, coming kind of being here new, and I think over the last 2 years we've really done a wonderful job collaborating, working hard with the task force of public health to improve Portage County. But really we hope the information that we gather here to, over the next several meetings, for that matter, in several months, will really yield some true issues that we can either join forces and collaborate on to address, or you know, figure out a way to really address some of our health needs in Portage County that we know are there, we know they're persistent needs, and that's where your expertise is really going to be valuable to us going forward, without a doubt. Because you know, this is really a first step in probably a good 1.5 year process of really changing how we conduct business towards public health in Portage County. So we're very excited to have you here. Once again, thank you very much for offering your valuable time, because we know how valuable that time really is, especially this time of year, without a doubt. I'm going to yield to Chip here to have some few words.
I think Jeff did a great job. You're definitely welcome. I heard someone say, we were talking and I said it's the same people, and for the most part it is, but for this exercise we need some dedicated people that have a good understanding of public health and health in general in this county, so that we can do a better job. And without you people, we all have to make our own decisions, and we kept our head in the sand too many times and lived on our own little island. Well, we've got to build those bridges, and I'm not just saying that. It's important for grant monies now. It's important for everything that's going on in the health field as we all grow older together. So I really appreciate it. And Jeff and I both seriously mean we really do appreciate you guys coming out, and really hope you'll stick with it, because we need you.
I'll just jump right in here and briefly thank Chip Porter and Jeff Neisted and their staffs and the folks in Ravenna for the work that they've done over the last several years. I've had some involvement in that work for, I guess, 1 year to 2 years now. My name is John Hornbeek, and I'm with the Center for Public Policy and Health. As I look around the room, I've met many of you, not all of you, so I look forward to meeting those that I haven't met, and I look forward to getting to know better those of you who I have met but don't know as well as I could or should. I do think we've had a wonderful effort that's been going on here in Portage County for several years, and the willingness of folks around this table to come together and discuss what are the health needs in Portage County and how do we know their needs is something that is an important endeavor. Our hope is that we can, this evening or this afternoon, get on the same page as to how we want to go through that process. Before I kind of walk you through the agenda put together here briefly, I do want to point out something to make everyone aware. Josh Filla of our center staff is over in the corner, and he does have a video camera there. So I want you all to know that we're not having a mirage. We are being videotaped here. I want to stop for a moment before we go any further and ask if anybody has any concern about that. Before I kind of yield the floor, though, I do want to explain why we're doing this. There were a number of individuals that were going to be a part of this group who could not make it today. We've now run and been involved in facilitating a number of these meetings over the last several years in the public health arena. And one thing we've learned is that probably the single hardest thing about what we're doing is getting the scheduling in place. When you get this many busy people, and you try to align their calendars, that is quite difficult. The people who weren't able to make it today were interested in what's happening here, so we are intending to videotape this on their behalf. Likewise, I think it's our hope to set out a schedule of meetings for this partnership over the next several months. And we know that in advance that we're not going to be able to schedule meetings that meet with everybody's calendar all the time. So one of the solutions that we've come up internally after, quite frankly, not dealing with this issue very effectively in a number of other instances, is to try to videotape these meetings so that we can have our colleagues who can't be with us benefit from it. It also may help us in clarifying minutes where needed and so forth. It is intended to be a recording of our processes and dialogues, and then a means by which a broader array of people can participate. I'm going to just stop for a moment. Does anybody have concern about videotaping of our discussions today? I'm going to see smiles and a few nods to mean we're okay with this. Is that? Okay, good, thank you. Few are nodding very clearly, and I appreciate that in this context. Around the table, there should be in front of you now an agenda that we put together for our dialogue today. Does everybody have that, a copy of that agenda? We had 29 or 30 of them, and so there should be one for everybody. If somebody does not have them, let us know, because we do have more.
One more here.
One more coming down? Okay. There we go. Any more? We got more coming, too. I think we're okay. What I'd like to do very quickly is just walk through what we had hoped to accomplish at this first meeting of the entire group. One, we want to take a few moments to introduce ourselves to one another, to know who is around the table, so we can get to know one another a little better. And I'll ask you in just a moment to go around and do that, hopefully briefly, so that we can start with the dialogue that we've got in front of us. We do have a set of goals and a charter, if you will, a draft document that tries to identify what we're doing here. And I want to share that with you, and we will have some dialogue about that to make sure that people are understanding, why the health departments have brought us together, and also understanding where we're going. You'll note that it does have draft on it, so if there's a reason to change it, we can do that. This group is here to guide our overall efforts in the county, and I would just stop and comment and say that Chip and Jeff and Kelly Engelhart, the folks from the 3 health jurisdictions and their staffs, have been very clear in the discussions they have had with me as they've asked us to play a facilitator role in this process, that they would like to have real input, quality input from people who know this business. And so you all were selected or asked to be here today because that's the way people view you. And so if you have comments, please make them. That's why we're here. Third thing on the agenda is there is a process associated with a community health assessment. And we've done some, these are done all over the state, indeed they're done all over the country. And we wanted to take some time today and describe how we envision that process taking place here in Portage County over the next several months. So we will have a dialogue about that as well. And then finally, if time allows, we can talk a little bit on a preliminary basis about health needs themselves. We'll have plenty of time to talk about that subject in the upcoming several meetings. But our hope here is to set a framework so that we all understand what we're doing, why we're here, and where we're going. And if we walk out today with that framework understood and adjusted if need be, so that we feel we're spending our time productively, then we'll have done largely what we want to try to accomplish today. So I'm going to just stop a moment. Does that make sense in fraud relief? Okay, maybe I'll just turn one, I'd like to ask people to introduce themselves very briefly, and I think three things I'd like to ask you. Mention your name, any affiliation or background that you think might have to do with why you're here, and then why you said yes, you'd spend 2 hours with us on a summer afternoon in June. I think you all have many things on your plates, I'm sure, but I'm hoping you saw some value for your work, for what you do in being with us here today. And I think one of the things we want to understand is what's that value to you, so that we can collectively create something that is valuable for everybody. And if we do that and do that well over time, I think there's a very good chance we can all create greater value together in the future.
I'm Gene Bonanger. I'm here representing the Kent Environmental Council. I've been associated with for 40 years. Our very name suggests the kind of health concerns we have. One of the most immediate ones has been the drilling process called fracking and all implications of that for water quality, air quality, you name it. Also served 24 years as a trustee of Robinson Water Hospital. My successor is also part of this group.
Brian Duchamp, I'm CEO of United Way of Portage County. We are interested in this work because we're currently funding about $140,000 of health and health-related programs every year. So we want to make sure we're funding the right kinds of programs and getting the right kinds of outcomes.
Chris Drummond, CEO of Access Point Community Health Centers. Obviously a need for us to understand what the needs of the community are, to make sure that we're adequately assessing those and addressing those. And just a personal interest, and just as an MPH student myself at one time, and getting that degree later in life, just making sure that I feel a part of what's going on in the community and helping to share ways and strategies for solving issues.
Hi, I'm Minty Guys. I'm a nurse manager at Robinson Memorial Hospital. I'm manager of the health education, so we do all of the community outreach in the community, so certainly see the needs. From a public health standpoint, from a different side, but certainly a healthcare point of view. As part of the original group with this grant, and had some continued interest to continue on, so I'm happy to be here.
Jeff Neistat, City Health Commissioner.
That's all you need to say,
I said my
Jeff.
spiel already.
My name is Amy Lee. I'm professor of family and community medicine at Northeast Ohio Medical University, and I'm also program director for the Consortium of Eastern Ohio Master Public Health Program. Everything we have is a really long name. Obviously, as a program director, I'm interested in public health. Since I work in Portage County, of course I'm interested in public health. And I work with all the health commissioners in Portage County. Many of them are invested as well in our public health program.
Bob Howard, I'm a trustee of Robinson Memorial, also a member of the board of the county health department, and generally what she said.
I'm Frank Hairston with PARTA, but I'm also members of the NAACP, King Kennedy, and also 2 or 3 other organizations in the community, so I guess I give them a little perspective that you want to hear, so, and I do have the good, bad, and the ugly to talk about.
I'm Danny Dearberry, trustee of Atwater Township, also a former president of the Township Association for Portage County. I also served on the task force for public health. In fact, we were still on that committee. Haven't met for a while, but we heard it's an ongoing thing. Also a member of several committees on EMA. I can go down the list of probably a half a dozen more. But obviously very much concerned about public health and the community in general, and that's why I'm here.
Sorry, that'll happen quite a bit. I'm Dennis Buscemi. I'm a major for the Portage County Sheriff's Office. I'm here because the sheriff told me that. I also have served on the Mental Health Recovery Board. This is my, I forget how many stints, but I've been on it a number of times through the years. I think the first time I was on for like 16 years, and I was off for a few years, and I just went back on. So.
I'm Carol Beatty. I'm the Chief Program Officer with Family and Community Services, and we're a local nonprofit, primarily based in Portage. We have over 40 different programs, and a lot of who we serve are those that are homeless as well as low income. So we definitely would have an interest in being part of this, myself included in that. And I'm also on the board with Robinson as well.
Joel Mallory, I'm the Director of the Mental Health and Recovery Board in Portage County. So first of all, I appreciate being invited to the table, and they're smiling over there, because I always have the behavioral health care, mental health and addiction services is health care. It affects people's lives, and so I'm glad to see we have Town Hall 2, Children's Advantage, Family and Community, and I know Sandy Meyer just invited from Coleman, so appreciate being at the start of this. Part of it is a mandated responsibility for us to do community needs assessment annually anyhow. So I would rather do one that's really a true assessment that includes physical health care, environmental concerns, as well as addiction issues. So thanks for inviting us.
My name is Dwayne Chip. Please call me Chip Porter. I'm the Health Commissioner of Portage County Health Department. And I'm not going to take Jeff's route. I am going to take this opportunity to speak, as I always do. But, first of all, I want to say that to our health department, when I said stick head in the sand, I meant our department. When I look around this room now, I don't see many people that I don't know there. 2 years ago, I'm not sure I could have said it, because we were an island unto ourselves. And it's so good to do this. We've looked around at other health departments that are involved in this process, and many of them are doing this internally. And that's what I conceive of mental health, and I conceive of minority needs, and those homeless, those type of questions. We don't need mine or Karen's or Becky's ideas. We need the ideas of the people that are out there working in the community. We've also added, just at our last meeting with John, we're not only going to try to establish the priorities that we in this room feel are important, but after that, we want to go to the populations we serve and find out what their needs, what they perceive as their needs, and take a look at both of those before we make our final decision as where to go into our improvement plan, which is the next part. And the community health assessment and the community health improvement plan are just that, meant to be community. When we get to the required strategic plan for the health department, that is an internal issue. But we need your help to do that, and we really hope that this process will do that. The Portage County Health Department has put a substantial investment into this process, into the next two processes, and hopefully also we want to get in line for accreditation also. So the two ladies to my left are very instrumental in our department in doing that. Karen will lead the charge because she's the only person I've ever met that's really excited about going through this process. So we're looking forward to all of this happening. And for those of you that haven't read the newspaper, I believe that hopefully on July 7th that the Ravenna City Council will vote to consolidate with us. The township trustees, my advisory committee that are the governance for the health department, have already voted to approve a consolidation with Ravenna City. So we're waiting for Ravenna. And like I said, only politics will stop it now. So we hope that you'll all get into the process, and we think it's going to make us a better health department with the addition of Ravenna for the population of Portage. Thanks.
I'm Karen Town. I work at Portage County Health Department. My main roles are the Child and Family Health Services Grant Coordinator. So many of you know who I am through the Maternal Child Health Assessment, and a lot of you have helped on that, so thanks. And that's still going on, but it's going to fold into this larger process. That's one of the hats we're wearing here. The other one is accreditation, as Chip mentioned, and I just want to echo what he said about how important it is that this comes from you and from our residents of the county. I am, not only do I work in Portage County, but I live here too, so this really is my home, and it matters to me what we do to improve the programs that we can roll out. We have a lot of opportunities. I'm super excited to get your ideas, so you're really, really are going to take what you have to say, be it good or bad, be it pointing out strengths or pointing out critique, and we are going to do something about it. That's the hope.
Those two are really tough act to follow, so I'll just tell you who I am. I'm Becky Lane, I'm the Director of Health Education and Promotion for the Portage County Health Department, and pretty much what they said.
I'm Mary McCracken, I'm the Clinical Director at Children's Advantage, and I'm excited to be invited to this. Mental health and health are so interlocked, and yet they've been kept in separate silos for so long, so it's nice that we're finally being able to talk. And mental health, we don't understand all the health issues and what questions to be asking our families. Becky's been an awesome resource for our staff who have called when we didn't know what to do with various things. NeoMed has now got a partnership with us, and we have someone coming in and training our staff on health issues, and we're also looking to have some kind of partnership with Access Point as well.
I'm Denise Lucas, and I'm a nurse practitioner for Planned Parenthood Kent Health Center. I am a very recent, as of April, transplant from Cincinnati. I spent the past 33 years down there. So a lot of coming here for me was learning who you are and developing some resources. As a new member of the community, we serve a fair number of people, both transients from Kent State and residents from the area. We would like to expand that service to provide excellent health care to those patients and both women and men. And I need to have referral sources. I need to know what's out there in the community so that I can tell them this is where you go for mental health, substance abuse, those kinds of issues. I also have a very deep interest in substance abuse and how it impacts the physical health care of women specifically, because my background is in women's health. So how that substance abuse impacts women and their lives on all kinds of different levels. So I'm excited to be here. Thank you.
I'm Joe Hickman from the Renaissance Family Center in Windham, Ohio. I was invited by Josh, and we are glad to help in any way we can. I'm the temporary director there. I shared that with another excellent gentleman, David Gray. This is my wife, Judy. I brought her along with me because I have a health need. I have a hearing problem, and I don't have a hearing aid, so if she needs to write something down I missed, she's going to do that for me. But we have many programs there. The Salvation Army's in our building, Wyndham Library's in our building, Town Hall 2's there, Becky's been to our building. And it's got potential, which is not truly reached at this point, but we'd be glad to participate in any way we can. I know nothing about the medical field, but if we can learn from you and glean from you something that we can do, that's why we're here.
Hi, I'm Sue Whitehurst. I'm the director at Town Hall 2, and it's nice to meet you.
Yeah.
And welcome anybody in substance abuse. We're glad to have you around, so that's great. I'm ditto with Joel. It's really great to be part of the community here, and in particular be invited to this process. Town Hall 2 does a lot of different things. Most people know us for our drug and alcohol program, but we also have a Victims of Crime Outreach Rape Crisis piece in the county that a lot of people probably don't know about, except for the victims. And we also have a number of other services. Our free medical clinic is actually in its last year. We'll be closing our facility in January 1st of this coming year. We'll still have somebody on site for the next 6 months after that to close cases and move people into referral sources. But we're just glad to be part of the process, and I'm with Joel. It's nice to have behavioral health be part of health and vice versa. I'm really glad to be here. Thanks.
Hi, I'm Heather Baird. I actually wear quite a few different hats. Today I'm here as part of the Center for Public Policy and Health, and I have to look and make sure I get that name correct. As Dr. Hornby has picked me up to help with this community health assessment here over the summer. But technically I am an assistant professor in the College of Public Health at Penn State University. by contract, I serve as the epidemiology chief at Summit County Public Health, and by contract, as the epidemiologist at Portage County Health Department on a couple different projects, specifically for emergency preparedness, communicable disease reporting surveillance. I am an epidemiologist. And also with Karen on the Maternal Child Health Consortium. So I was able to participate here in this county putting together the Maternal Child Health Assessment.
I'm Catherine Schoenwald. I teach at Imo College. Nursing, I'm actually a nurse practitioner, a pediatric nurse practitioner, but I was involved with the Maternal Child Health Consortium, which I found fascinating. I guess on a personal note, the reason I'm spending 2 hours with the bus or whatever, because I believe that teaching nursing involves knowing what's going on. It's not an uppity thing where you're looking in the big picture only. You need to bring it down to the level of where students are going to be practicing. I think that's important. And on a real personal note, I'm a PhD student looking at foster care and belonging and health disparities in the foster care population. So I think, personally, I think that's going to be fascinating for me, just like the consortium.
Josh, do you want to introduce it? Sure.
Josh Philo, staff member with the Center for Public Policy and Health. Looking forward to helping Dr. Hornbeek and you all move the process along. I do weddings on the weekends. Give me a call.
Josh is also the rolls downhill guy.
Yeah.
He's at the bottom of the hill there. He does a damn good job.
Thanks, Jeff.
Hi. My name is Nishikant Kamble. I work with Dr. Hornbeek and Josh at Center for Public Policy and Health. I'm a staff member there. Thank you everyone for coming.
Thank you, Nishikant, Josh, and all of the folks, both of whom I've met and some of whom I have not. Appreciate all of you coming and spending your time here today. I'll just comment very briefly. As you all went around the room, I learned a number of things. There's some of you who I have not had an opportunity to meet, but I became convinced that we've got good people in this room to do what's in front of us, and I just appreciate the time and expertise you're bringing to this process. I think what I'd like to do for a moment, and I'm going to ask Chip and Jeff, and I'm thinking Bob Howard to chirp in if I miss something here. I want to take just a couple of minutes for those of you who are with us to share at least my perspective on what's been going on that has led to the work that is happening today and over the next several months. Several years ago, I think it was March of 2011, there was a group brought together, in part under Bob Howard's leadership, to look at the way public health is done in Portage County. And I think there was an interest on Chip Porter's part, and Jeff Neistat was, I don't know if you were quite here, but close to here, right, Jeff, at that time?
Close, yep.
Close to here. When Jeff arrived, he took interest. The folks in Ravenna took interest. I think Chip's comments this afternoon really prefaced what he was trying to do and others were trying to do in bringing the 3 local health departments together to work more closely. Dan Derryberry was probably at those very first meetings as I'm looking around the room. So there are many people that know more about the origins of this than I do, I would just mention. But I do know that was when things got going on this overall effort. Based on that work, there was a report issued that basically said, you know, we can do better as a county. And I think that was the conclusion. Collaboratively and perhaps in some cases, you know, as individual institutions and organizations trying to look with a wider lens. And over the last several years, since I've become involved in the process, my perception is that is what's been happening certainly at the health departments. They've been working very closely together to the point that we're now seeing them together on a very regular basis, and I think some positive things are happening from those efforts. There was a series of grant applications that were put together in part based on those processes, one to the Robert Wood Johnson Foundation and another to the Local Government Innovation Fund. Those grant applications were successful and provided some foundational funding to bring together a number of groups, and I'm speaking now particularly of the Robert Wood Johnson Foundation effort. 3 work groups were established under that effort, one on strategy and action in public health, one on evaluating current service provision in public health, and a third on education. All of these work groups, for a period of a year to a year and a half, focused extensively on the connections across the 3 health departments. And those work groups made some recommendations about what the health departments may want to consider doing. These were recommendations that were welcomed by Chip and Jeff and others. They received those recommendations last fall, one of which was to conduct a joint community health assessment and joint community health improvement planning process. And I think Chip and Jeff and others looked at those recommendations and came to the conclusion that that was a good idea, and they took some initiative in getting back to us and endorsing those recommendations and asking to see that process continue. Those work group recommendations and the health department endorsements of them, along with the continuing guidance of the Task Force for Improving Public Health, which Bob Howard and Ralph Kletzian chaired and led, and Dan Derryberry has been a very active member of, essentially yielded the fact that we are here today, because we are in effect implementing what the health departments have now jointly decided to do. I think they spoke for themselves earlier as to the whys and wherefores of that. One of the things that was in one of the recommendations that came out of one of the work groups is not only that there be a joint community health assessment process and a joint community health improvement process, but that it be done according to a model that was familiar here in the county. And that model, which Karen Town is quite familiar with, is called the Community Health Community Health Improvement Cycle. I keep getting Chip and Chick mixed up. I'm sure I'll mess that up several times during the course of the summer. So there is a framework under which we are operating as a group if we are to continue following the recommendations of that work group and the subsequent endorsement of those recommendations by the health departments. And what I'd like to do now, if I can, we've got that model someplace in here, is send around a little graphic on this. I have to credit Karen Town and Katie Ferguson of our center staff for this model, but it outlines the process that is envisioned for going through a community health assessment and community health improvement planning effort. Just by way of background, those processes are also required by the Public Health Accreditation Board. So that if the health departments in Portage County pursue accreditation in the future, one of the things that they ask is, how did you organize this effort? What model did you use? And there are a number of different models that could be used. And so the decision or the judgment to follow a model was not just because somebody wanted to draw nice diagrams. There was an underlying rationale for why that was looked at. And what you've got in front of you is a representation